Hey, this is Dr. Barry. In this short video, I want to talk to you about the 7 signs that your vitamin D level might be low. Now, some of you have already caught on to the vitamin D epidemic of low vitamin D in the US and Canada, but many of you have not, and that's what I want to talk about today. Vitamin D is a big deal. If your levels are low chronically, it can lead to suffering, early disease, and early death. And so we want to avoid those 3 things all we can. Now, if you already know about vitamin D and you take a good supplement, I bet you have friends and neighbors who do not know. Please share this with them on your social media, email it to them. You can text them the link. You can share this in any number of ways to help me help even more people. Now, let's talk about the 7 signs that your vitamin D might be low. And I may even talk about what you can do to fix it at the end. We'll see. So, the number one for an adult, the number one sign that your vitamin D might be low is bone aches. Okay. If your bones ache, not your joints, but your actual bones themselves, that's actually, if your vitamin D is low, that's a condition called osteomalacia, which means painful bones. And when your vitamin D level is below 20 or 25, you can have osteomalacia or painful bones. This is a sign that your bones are starving for vitamin D. They're not being able to keep their bone density up where it needs to be. This is your bones yelling at you, hey, dummy, take some vitamin D or get out in the sun, right? So, osteomalacia is a big deal. If you don't have enough vitamin D, it can actually lead to osteopenia and ultimately osteoporosis, which are brittle bones. And that's the condition that older folks have when they fall on the carpet and break their wrist. When you fall down on the carpet, you shouldn't break any bones. If you do, then you've been vitamin D deficient for a long, long time. So, achy bones, that's sign number one that you may have low vitamin D. Sign number two is chronic fatigue. And I know that's the sign of about 1,000 different possible conditions. But if you go see your doctor for chronic fatigue, one of the very first things he should check is a vitamin D25 level to see if your level's low. That's an easy fix. It's an easy catch and easy fix if he checks the right lab work. So chronic fatigue can be from low vitamin D. The next is if you have a fracture, a broken bone from just a little bit of force. If you step off the curb and break your ankle, if you fall and break your wrist on carpet, right? If you just like fall off the couch and break your wrist, that's not normal. Human beings are made to bounce, not to break. And so I've seen so many patients in my office come for follow up after they've been to the orthopedic surgeon for a broken wrist, just like this. I was leaning over to get something to pick it up off the floor and just fell off the couch and broke my wrist. That's not normal, okay? And the orthopedic surgeon did not check any blood work. So when I checked their vitamin D level, it would be 8 or 12, and it should be over 40, okay? So if you have a broken bone for no real reason, like if you're coughing a lot from bronchitis and you break a rib, that's not normal. That shouldn't happen. You probably have low vitamin D. If you have frequent, this is number 4, if you have frequent viral infections, like it seems like you have a cold every 10 minutes, right? Or you just have just repetitive infections way more often than your friends do, that could be a sign of low vitamin D because keeping your vitamin D where it needs to be can actually protect you from infection. If you have, number 5, if you have depressed mood, I don't mean, clinical depression. I'm talking about just depressed, kind of down in the dumps. That can be from low vitamin D. More and more research is coming out to show that vitamin D is very uninflammatory, both for your brain and for other body tissues. And so one of the things that you could have is a depressed mood if your vitamin D is very low. So part of the workup for depression when you go to your doctor should be some blood work, and within that blood work should be a vitamin D 25 level checked. And if it's low, it needs to be fixed. Number 6 is slow wound healing. If you get a cut or an abrasion and it seems like it just takes forever to heal, if it seems like you heal far slower than your friends and family, then you may have low vitamin D. Vitamin D is in charge of hundreds of biochemical reactions in your skin and in other parts of your body. And your skin just doesn't heal as effectively if your vitamin D is low. So that's another red flag that you may have low vitamin D. Number 7, it's kind of like number 1, but it's different. If you have muscle aches, just your muscles ache for no real reason. Now, if you walked 10 miles yesterday and that's the first time you've done that in years, it makes sense that your muscles would ache. But if your muscles ache all the time and there's no real reason for it, you may have low vitamin D. Obviously, there are other things that could be, so go see your doc and get a full lab panel and a full exam, but you may have low vitamin D. And something as simple as taking vitamin D3 every day could fix your achy bones and your achy muscles. Number 8 is basically if you live in the US and Canada, this is a bonus. If you live in the UK, if you live in the US, if you live in Canada, if you live anywhere up in the higher latitudes, you don't get enough sun to make vitamin D, okay? And so my hierarchy, my solution for you if your vitamin D is low is to get more sun. If you can't do that, then you can get more vitamin D in a good ketogenic diet. If you're eating grass-fed butter, that has vitamin D. If you're eating the egg yolks from chickens who are able to run around in the yard and eat bugs and worms, those egg yolks have vitamin D3, right? So butter, and then if you're able to eat pork that's been pasture raised and actually was allowed to run around and eat grub worms and acorns and other good things and play out in the sun all day, that pork will have good vitamin D. And so I'd much prefer you get your vitamin D from the sun and from your diet. But if you just have to have a supplement, then make sure you're taking a good vitamin D3 supplement, not D2. Maybe your doctor says, oh, you need to take this vitamin D2 once a week or once a month. Don't take that. It's just not as well absorbed as vitamin D3. Vitamin D3 is a much more natural way to take it. And so if also a lot of people think dairy is a good way to get vitamin D. It's a terrible way to get vitamin D. It's been fortified with vitamin D2 as well, which is, again, not as well absorbed. So if you can't get it from the sun and you can't get it from your diet, then take a supplement. And some people need to get it from the sun, from their diet, and take a supplement. It's up to you. You decide which one of those people you are. But if you do take a supplement, make sure it's vitamin D3. Make sure it's in an oil-filled gel cap, and make sure that the oil they use is not soybean or canola oil. You can get one off Amazon with olive oil, and that's much preferable to taking one with canola or soybean oil. So there you go, the 7 signs that you might have low vitamin D. And then just a bonus, if you live in the US or Canada or the UK, then you're at very high risk of having it because there's just not a lot in the food supply and you don't get enough sun to really make up the difference. Now, if you enjoyed this video, please consider subscribing to my channel and clicking that little bell so that every time I get a bright idea, you'll be one of the very first to know. And if you feel like my videos have really helped you and maybe even changed your life a little bit, click on the Patreon link down below. You can throw a buck or two my way, and it just helps me have more time to make more videos just like this. This is Dr. Barry. I'll see you next time.